Hello and welcome to the Success Showcase. I'm your host Eric Lopkin from the Modern Observer Group, and with me as always is Chip Janiszewski from the Happiness and Success GPS. Chip, how you doing this week?
Doing great, Eric. Happy December.
Happy December. I think November was actually a bit colder up here, but as
And
we're
very wet.
yes, it's been very wet as we head into the holiday season. You're starting to see the Christmas lights go up. Things are taking shape.
Yeah, I have a date with my wife tomorrow to get a tree. So there you go.
There you go. So, over the past couple of weeks, we've been talking about preparation, business plans, marketing plans, personal growth plans, how to get through all of this planning. Today, we're going to take a little bit of a departure from that. We're actually going to talk about when things go wrong, and in this case, potentially catastrophically wrong. We have as our guest Bob Newbold. Bob went through a massive health condition scare, and we will let Bob tell you all about that. Bob, how are you?
I'm doing great. How are you guys doing today?
Doing fantastic. We're glad to have you here.
We
Well,
certainly are.
I'm thankful to be here, and I appreciate the opportunity to get on and tell my story.
And so, why don't you tell our audience what happened?
Okay. Well, in a nutshell, I was at work on a Monday. It was actually March 20th of 2017, and it was just a normal Monday. Was at my desk. I remember I was getting organized for the week and just putting some things together that I wanted to do and everything. And came to be lunchtime, and sometimes I go out, sometimes I don't eat, and sometimes I bring something back to my desk. But the good news was I didn't go out that day for lunch. About 1:15 in the afternoon, I was sitting at my desk. I got up, uh, started walking across the office, got about 25 feet, and noticed my right arm was just hanging limp. And recognized that as not normal. So I remember thinking I'm gonna go back and sit down and figure out what's going on. From that point where I was back to my desk, I don't remember that walk at all. But when I got to my desk, I collapsed um, between the chair, the credenza, and the desk, and made a lot of noise. Fortunately, and people I work with heard me and came running in. And I'm fortunate I work with my wife, and they called her in. And first, she thought I was having a heart attack. I was on the floor, as I said, and she said, I thought it was a heart attack, but you were breathing normally. So then it hit her, it must be a stroke. So they proceeded to call 911, and we were fortunate we have AMR right down the road here from my office in West Hartford. So they're close by. Also, the fire department in West Hartford's the first responder, and they're right down the street, and as is the police department in a different direction, but also close by. So everybody descended to my office, and they came wheeling in with the gurney and everything. And of course, we said stroke, or my wife said stroke. I couldn't talk and couldn't move my whole right side. So they have their protocol. They don't take a word on it, but making sure it's not a diabetic seizure or some other complication. But they ascertained, yes, it is a stroke, and brought me out to the ambulance. Um, that's a ride I'll never forget. Um, I was fortunate in the end that you'll hear how well I came out of this. But one thing I'll never forget is riding in the ambulance, looking up at the ceiling, not being able to move my whole right side, not being able to speak. And while they're putting an IV in my arm, um, just thinking, well, I guess I'm left-handed now, and I'm a left-handed emailer since I can't talk, and starting to make that preparation. Like, is this going to be it from now on? Not seeing any easy road to recovery, and kind of jumped ahead to the worst. The worst thing that could happen. So anyway, bottom line, we get to the hospital, and I get wheeled right into the stroke emergency unit. I say I got the easy pass right in, wheeled past a bunch of people in the emergency room and everything. And there was about 20 people standing around, nurses, doctors, all the radiologists and the anesthesiologists and everything, and they all knew because the whole time in, the paramedics on the horn with the stroke unit, so she's relaying readings and situations, and so they know exactly what's coming in when I get there. So they went to work and do what they train 24/7, 365 to do. And Hartford Hospital is the comprehensive stroke center, one of two in Connecticut. And just for anybody listening, if you have any heart or stroke related ailments, Hartford Hospital is the place to go, especially stroke. But they're able to do things there that other hospitals aren't equipped to do, and I can explain that a little bit in a few minutes. But bottom line, they started working. I was awake and listening to them speak and everything, and just kind of saying, what the heck's going to go on? What the heck's going to happen? Um, so the first thing they do is the IV that they put in. There's a drug called TPA, and in my presentations I call it Drano. It's a heavy duty, like a blood thinner type thing, anticoagulant, and they put that in, and that's got to be done within certain parameters. I think it has to be done within 3 to 4 hours of a stroke. They have to know exactly. They had to certify when somebody last saw me normal, which was a couple of people said 5 years ago, but uh, somebody had seen me about 1 o'clock in the afternoon, and my thing all happened about 1:15, so I was well within the parameters there. But so they administered the TPA, and the next thing was what really I owe my recovery to is a procedure called a mechanical thrombectomy, and nobody's probably ever heard of that. I know I never did, never dreamed what they could do, but they insert a tube um, through the. They go in your groin, go up through your heart, through your carotid artery, and up to the brain, and they took out the clot. So it's quite a thing. The tube, there's a mesh that is inside the tube. When they get to the clot, they release the mesh. The clot's kind of a jelly type of thing, I guess. I always thought it was maybe something a little firmer than that, but the clot gets in the mesh, and they're able to pull it back into the tube and take it out. So that freed up, the clot is disrupting the flow to the brain, the flow to the blood of the brain, and that opened it up. And I just recently found out that they actually went in twice, uh, got, I don't know, part of it or whatever, but went back in. And I like to say, they're pretty amazing. I'd love to watch it done and see how it is, but they're watching screens and watching that little tube go through. And I like to say, when they got to my brain, it was easy. It was not too congested there, and wasn't much there, and they were able to just take the second right and the first left, and there the clot was. So it's so I have a little fun, you can tell, with my presentation, but bottom line, it's just unbelievable what they can do today. And so since then, my mission has just been to be out spreading the word about stroke, kind of technology, what happened to me, and how to prevent a stroke, or at least minimize the chances, and also to recognize a stroke. I tell people you don't need to know how to fix it; you just need to know how to recognize it and call 911 as soon as possible.
Now,
So,
before this happened, did you have any symptoms? Did you have any clue that anything was wrong?
no, I have AFib, atrial fibrillation, and if there's such a thing as a mild case of AFib, um, I think I have it. What brings it on to me, and that's an irregular heartbeat, um, as they say on the commercial, not caused by a heart valve problem. All kinds of drugs for that now, for the to keep the blood from clotting. But it's it's when one side of your heart is fluttering, one side's beating, the other side's fluttering, and the blood pulls and or can pull if you're in AFib, and that's when the clots can form. So um, I was always able to tell when I went into AFib, and it was not very frequently. When I first got diagnosed, your medication for that was Coumadin, and Coumadin, you've got to have your blood checked constantly to keep the right, you know, consistency. So you're always going for blood tests and everything. So it's really a pain in the neck. Um, and the doctor said, well, as long as you tell me, and he knew that I could tell when I went into it. He says, you tell me, come in, we'll put you on Coumadin, get you going on that. So we did that for a while, and over the years, the events got fewer and fewer, and so I wasn't you know taking Coumadin very much at all. I mean, I would go maybe years or whatever without an event. So over the years, I can remember the doctor saying in physicals and things, they have some new medication now, and you don't have to get your blood checked all the time. And of course, being the typical macho man who doesn't want to take, any more medication than he has to, I said, well, we'll just keep going the way we are. So I can remember about 6 weeks before I had the stroke, I had my annual um, cardiologist appointment, and I had just had the stroke, the stress test and a nuclear stress test, and he said, everything's working good, and he said, honestly, um, your biggest health risk is a stroke, but you're at a very low instance of having one. So I came out of there with a little bounce in my step and saying, hey, I'm cool, everything's working well. So uh, so there were really no signs uh, showing of any reason why I would have the stroke. I had no symptoms. Um, so that was just a crazy thing, and that's what a stroke is. Just hits you out of the blue. Um, Thinking back in reference to that AFib, behind the scenes there may have been some, little minor events or something that the clot may have formed over, months, years, whatever they take, and they said it just broke loose from inside my heart and went up to the brain. I said, how long does that take? He snapped his fingers. He says, like that, So we had just been to Boston the day before up to my grandson's baptism. So thank God it didn't happen on the road or out in the middle of nowhere on Route 84 or something like that. The Saturday before that, that day I was in the office by myself for 3 hours, and God forbid it happened then, I wouldn't be sitting here talking to you today. So I really say my stroke was a perfect storm of things that went right. I was with people. People recognized the stroke. People called 911. I was at the hospital. My office is right at the entrance to 84, heading towards Hartford. So it's a short hop in there to the hospital. So I was there, probably within a half an hour from the onset, if it was even that long. So again, the stroke unit there, they practice all the time, and this is what they're getting ready for, somebody to come in like that. One thing I want to add to that too, I said called an ambulance. The thing you don't want to do is ever drive the person, unless it's an absolute case where you can't get an ambulance for some reason. But you think maybe you could get them there quicker. Well, the whole time I'm in the hospital, they're on the phone or radio, however they communicate, with the stroke unit, and they're doing whatever they say, taking readings and whatever, so that when you get there, they know what they've got coming. It's not like you bring somebody in and, well, I think he's having a stroke, and you got to wait for people or whatever, show your papers and all that kind of stuff. I mean, you want to get there, and because they say time is brain, every second that you're in stroke mode, your brain cells are getting killed by the millions. So you want to get there as soon as possible, and that just makes it as efficient as possible. You know, you may take you longer to get there with an ambulance, but you're going to be way ahead of the game in the end. So.
Right, and your treatment didn't start in the hospital. Your treatment started in the ambulance.
Well, the preparation for treatment. In other words, they gave me TPA at the hospital that went into the port that they put in the ambulance. So, but they were taking other readings and blood pressure and all this kind of stuff. So they were doing things, keeping busy, but nothing, you know, as far as any medications or anything like that was done until I got to the hospital.
And then after you got done with the procedures, you were home so quick, and walking the dog a couple of days later. I mean, tell us about what happened after everything got under control, and then we can talk about where you are right now, because you and I have been close for a long, long time, and you know, God bless us that you are here. But I always say that, you know, things happen for a reason, and you were meant to have a stroke, and you were meant to survive, so you could go out and do the wonderful things that you're doing now to help other people through the situation that you just survived. So tell us about the aftermath and, you know, the trip from point A to point B and where we are right now.
Sure. Excuse me. When I was in the hospital in that stroke emergency room, my wife was outside in the hallway, and my one son came down from Boston, and the other one came over from his job at Pratt and Whitney, and I had one of my daughters-in-law was there, and so the doctors are going out and keeping them up to date with what was happening. And like I said, all they knew was I went in there, I couldn't talk, couldn't move my whole right side. So they told her they were going to do the TPA, and then after they did that and had their discussions, then they went out and said, you know, we'd like to do this mechanical thrombectomy. There's a risk, you know, what do you think? And my wife's there like, you know, do whatever you think you can. You know, obviously it's got to be worth the risk, because either you're the same way you came in, or you go out the way that I went out. Thank God she said, take a risk. So, but anyway, so they said, well, this is going to take a little while. I think it was like in the 4:30, 5 o'clock range. And they said, you know, he's going to be a while and under, you know, they intubated me for that. And so they said, why don't you come back? We'll have him in a room at 7:30 and you can see him. So as my wife says, they went out and had some coffee and stuff and came back at 7:30, and they got to the room, and they didn't know what they were going to find. And when they got to the door, they looked in, and by then I'm sitting up in bed, and I wave them in and say, hey, come on in. And they're like, what? So it's like, wow. So, yeah, that removing that clot got everything going, and there wasn't much damage done, obviously. And so that just started it. I mean, I was on the road to recovery there. They kept me over. That was Monday, so Monday night. Tuesday, they're running all kinds of tests, and they had me stay over that night. But in the meantime, I'm up walking around. Tuesday afternoon, they said, or Tuesday night, they said, we're going to put you in a step-down unit. So they said, we'll get a wheelchair. And I said, well, can I walk? And they said, okay. I was known as, you're the guy that had the stroke. So anyway, so Wednesday morning, he says, I'm going to send you home today. And, you know, you got all that checkout stuff you got to do. So by the time I got home, it was the afternoon. And we stopped by my office on the way home. And by the way, I walked out, you know, I walked down to the desk and I just walked right out, you know, when it was time to leave. And so they're all kind of amazed by that, at how well it worked. As a matter of fact, my wife said that the doctors were almost giddy after they did that mechanical thrombectomy, and they could see me start moving and everything. And because that's what they practice for. I'm how they want it to come out. And actually, that's my mission in my presentations. Is I want, you know, the next person that has a stroke to have the same positive outcome that I had. And it's just education and knowing about it. But
Yeah,
yeah, so
your
go ahead.
recovery was amazingly quick because I remember being told that you had had the stroke, and this was probably 4 or 5 days after you'd had it. And
Mm.
by the time I got a hold of you, you were already up and about.
Yeah. Oh yeah. Yeah. I was. I said we stopped at my office, and the guy that I work with, Gary Hunt, he came down. I stayed in the car. My wife came in because I had left obviously my briefcase here when they whisked me out, and so I picked up some stuff, and so he came down and he says, "I don't want to see you in that office till no sooner than next Monday." No, it's Wednesday afternoon. So I said, all right, all right. Well, I was back at work the next Monday. But one thing I remember was I left the hospital. I had no deficits, which is amazing in and of itself. And I needed no rehab. So that's amazing as well to have a stroke like I had. People say, well, was it a partial stroke or a mild stroke? And I said, no, it was a real deal. I couldn't move and couldn't talk. So, but it's the technology today, and so anyway, so my neighbor, we went home that Wednesday, and my wife and I took the dog out for a walk and everything. And my neighbor said, "I heard you had a stroke, and on Monday, and here you are walking your dog Wednesday afternoon." So I've been just spreading my word. I've been told, one particular guy I went to high school with many years ago, but he said strokes run in my family, and I've always feared having one. He says I still do, but what happened to you gives me optimism that it's doesn't have to be the end of the world. So but really so many people, I'd say 95% of the people that are treated for a stroke, at best they're coming out needing rehab and that type of thing, and have leftover deficits. So, and I'm technically a stroke survivor, and as I say in my presentation, I struggle with that because it doesn't feel like I had one. It's like it never happened. But the people that I think are the stroke survivors are the ones that come out with deficits and have to work hard to rehab and do all that stuff. But they're the ones I admire for how hard they have to work to get back to their normal life. So I think what happened is that I like to say I was in the ambulance, and God looked down at me and she said, whoa, we got to give this guy a break. He's got a big mouth and he knows a lot of people. We're going to make him a strokesman. So I'm the spokesman for the strokes now.
Let's talk a little bit about that. As Chip alluded to, you've been going all over spreading the word and talking about your experience. So tell us a little bit about what you've been up to.
Well, when I was, just out of the hospital and people got word of it, I got nice cards and I got emails and phone calls and everything. And one common thing was people said how much they learned about strokes from what happened to me. I learned a lot about it too, but I'd heard about strokes and I know people that had them, but I'd never really knew the different variations, different ways it could affect you and all that. And it's just like I said people are learning. They seem to be grateful to know this stuff. So I spoke to my nurse navigator from Hartford Hospital. She was tracking my progress after I got out. They make sure everything's okay and do you need therapy or anything like that. So one day she says, "Do you have any questions for me?" And I said, "Yeah, I was just wondering, what kind of outreach you have. Do you have it?" And she said, "Well, I ironically just got an email from my boss that said we should be doing more of it." So I said, "Well, you need some help?" And she said, "Sure, we'd love it." So that kind of gave me the start, and just knowing a bunch of people. Got a friend that's president of the Kiwanis Club in Newington. They have speaker programs and everything. And they said, "You want to come in and talk?" And I said, "Sure." Hartford Hospital. The other thing was just the timing of it, because stroke was late in March, and May is Stroke Awareness Month. So the hospital does a stroke conference every year on the first Saturday of May, and they asked me to come in and speak as a stroke survivor for that first one. So it's like a month and a half after the stroke, not even. And so I did a presentation there, and it's just kind of spread from there. I've done four different presentations at Hartford Hospital. I just spoke about 3 weeks ago. They had their annual corporators luncheon. There was about 150 people there, and the neurology chief of staff did his like a half an hour presentation, and then they had me come up and speak after him, and so that went well. But so between Rotary clubs and other civic organizations, churches, I've been at Newington Senior Center a couple times, Weathersfield Senior Center, Rocky Hill, things like that. So it's just a matter of being out there. It's it seems to spread, and getting asked to do a lot more things. I just last Thursday night I did an event for the Hartford or the Connecticut American Heart Association, and they had an event at Mystic Aquarium. I'm sorry. So I had some sharks behind me looking over my shoulder, but did my little presentation there, and apparently they're going to use me a lot more for getting out, so I'll be affiliated with them in some way. So it's working out. I was a good guy to give a pass to, I guess.
And of course, while all this is going on, you've received awards. I believe you were also featured on local television.
Well, they did. Hartford Hospital did a one of their things with Rachel. What's her name? Rachel Stewart. Is that her name? All of a sudden, my mind went blank. But they do a 2-minute thing for Hartford Healthcare, and that runs usually on Sunday mornings. And it's funny because it was running on their loop. You go into a Hartford Healthcare office or whatever, and they have their loop going through of all these patient stories and all that. So one of my neighbors works for Hartford Healthcare, and she says, "I'm tired of watching you." But anyway, it was pretty amazing. And then just some of the cool things, like there was a guy out in the Midwest. How are we doing on time? We doing okay?
We've got a few minutes.
Okay. There was a guy out in the Midwest who my son found via Google, who had basically the same situation I did. So I looked him up and called him up, had a nice conversation with him. But one thing he said that was cool was you should go back and thank the paramedics, the ambulance crew. So that was another thing that was timing, because I did that in May, that right after the stroke, and they invited me back on their appreciation day, employee appreciation day, and I got to meet the people that were on the ambulance, and got my picture taken with my ambulance number 927 and stuff like that. But they just they couldn't believe it, that here's a guy. I said, I just want you to know, so you can tell the next guy that's having a stroke, hey, we know this guy, and we took him in, and he couldn't move or talk, and he's out walking around, and he's fine, So that's the importance of getting it done quickly and everything. So, but we've done things like we had a strikeout strokes day with the Yard Goats last May, and we've got one coming up this year on May 19th. It's a Sunday, but I got to go down on the field, do my presentation, had my family and people from Hartford Hospital there with me, and had my mug up on the scoreboard out there, and they showed our story on my wife and I on that's been running on TV and everything. So that was fun. But the hospital appreciates it because it's just getting the word out. Dr. Alberts, who's the physician in chief and he does a lot of stroke presentations. They're more technical, and in my talk that day, I said, Dr. Alberts talks to people that know how to fix them, and I said I talk to the people that we want to recognize them. So that's the big thing. I'll just say quickly because I know you're coming down on time, but I said I can teach you fast how to recognize a stroke, and the way to recognize a stroke is FAST, F-A-S-T. It stands for face, arm, speech, and T is time to call 911. But you'll see crooked smile or droopy, look of the face. That's pretty blatant. That's a sign. My arm was totally numb and just hanging there. You could have weakness. What you do is ask people to put their arms out, straight out to their side, and if they're unable to hold that arm out there, that's another sign. Speech is could be jibber jabber, speaking, things that don't make sense, or you're slurring, or in my case, pretty blatant, couldn't talk at all, and those were all signs. So the key is any sign of a stroke, you don't mess around. Call 911. The paramedics will all tell you that they would rather come out on a false alarm than have you not call and suffer, more than you really need to. I've talked to a woman whose sister was with their mom, and the mother had a stroke and had symptoms, but she didn't recognize them. She didn't call 911, and she still beats herself up every day because she didn't call 911. So nobody wants an ambulance pulling up in front of their house or their office, but the thing is, it's the best thing. Just they'll all tell you it's better to overreact. Better to have them and not need them than to need them and not have
them. Yes.
Yep.
You're safe and sorry. Bob, when you do your presentations, there's a video that has the FAST acronym in there. I'm just wondering, is that available with a link like on Facebook or something like that for people to look at? Because it's very, very entertaining, but it's really, really to the point too. It's only like about a minute or two. So if you want to talk a little bit about that, that would be great. And maybe there's a link someplace where we could get that for the next show or to put on the website or something.
Yeah. It was actually done, excuse me, by the National Stroke Association, and everybody knows the YMCA. You do it at every wedding, but this is FAST, and I play it when I do my presentations, and I say I'm going to teach you how to recognize a stroke, and I'm going to play this song, and you're not going to get it out of your head for 3 days. But it's like you said, it's entertaining. But it's also it's not hard to recognize a stroke. I started asking when I do a presentation at the beginning, raise your hand if you think that you feel confident about recognizing stroke symptoms, and maybe you get 25 or 50% of the people that feel that. But if you just remember FAST and the face, arm, speech, and time to call 911. You've got good symptoms. Don't ever let the person lay down and take a nap or anything. If any signs, you got to get in there, because I feared that if I had been alone and my arm was numb like that, I would have, had I been home or something, I would have maybe said, well, I'll just lay down and see if it goes away. Well, I wouldn't be here today talking to you if that were the case,
Right.
So
the faster you respond, the better off you are.
Yeah. Yep. So, like I said, even if it's wrong, like if I have another couple minutes, the first presentation I actually gave was, I called it a dress rehearsal, but to our 7 a.m. network. And I said, I got to do this Saturday at Hartford Hospital, so I'll do a little practice here. So I had materials that I passed out and everything, and so I did it, and that was Wednesday. And on Friday, one of the members runs an organization in New Britain, and he's got like 45 employees. Well, one of them exhibited signs that was potentially a stroke. Jim said, I ran out to my car and got your materials, and we went through the protocol. It turned out it wasn't a stroke. It was reaction to some new diabetic medications that the guy had, but very similar, some of the things. But when the paramedics got there, he said we went through the stroke protocol. They were pretty impressed by that. So, but I mean, there's the first time I do the presentation, and you know, it was implemented. Let's put it that way. So you never know what's going to come out of it, how many people you can help, or they say if you save one life, it's worth it. So you know.
Absolutely. All right, we're just about at the end of our time. Bob, thank you so much for coming.
My pleasure. My pleasure. And if I have a page on Facebook, it's facebook.com/stroke awareness guy, and that'll bring you to my page of A Stroke of Luck. And I try to keep up to date with things that I'm doing on there, a lot of pictures and tips about recognizing strokes and everything. And also have an email. It's strokeawarenessguy@gmail.com. So if anybody has any questions or knows where I can go to do a presentation, like I said, I've been to churches and civic groups and all kinds of things. I did a presentation for Bristol Rotary, and a new neurologist from Bristol Hospital was there, and she wants me to come speak at Bristol Hospital. So
excellent.
It's going well, better than I could ever imagine. So get to do some cool things like podcasts with you. This is nice. I appreciate it.
And we're glad to have you.
Fantastic to have you, Bob. God bless, man.
Chip,
okay, thanks.
Chip, what do you think is the big takeaway from Bob's talk?
Fast.
Absolutely. If you get that, you know fast, you're prepared. And I think
Chip,
that's
Chip, you're a fast learner.
Send me my diploma.
There you go. I think one of the takeaways is that Bob's success really comes from a lot of the things we've been talking about over the past few weeks. It was people being prepared, knowing what to do, getting things done quickly, and all of that contributed to Bob's phenomenal recovery. And then we've talked a lot about networking. It was Bob's network that helped get him out and doing all of these talks. So a lot of what we've been talking about came to play here. So again, Bob, thank you so much for coming. You've been listening.
My pleasure.
You've been listening to the Success Showcase. You can catch us every week at xvadio.com/podcasts. You can also catch us on the iTunes Store, the Apple Podcasts app, iHeartRadio app, Spotify, and wherever you find podcasts. Remember, make this your best week ever and make next week even better. See you then.